you probably heard a lot about it in recent years, this whole idea of chronic. I suppose a lot of us are living older and we're facing an awful lot of problems now that we hadn't previously done. The word chronic essentially means persistent. It's an infection that you can't shake off. So clinically, when somebody presents in the hospital and they may have an infection with a particular bacterium, and the next time that they show up in the hospital it's gone, you'd consider that an acute infection. It comes, you get sick for a period of time, and it clears. But when you get a chronic infection, say you turn up 2 months later and the infection is still there, and 3 months later and it's still there again, that's what we call a chronic infection. That's an infection that we generally can't treat with antibiotics. It's an infection we have a lot of trouble with. And if we think of some diseases such as cystic fibrosis, they would incur an awful lot of chronic infection, so that when bacteria get in there, they can be very, very hard to shift. Now, what we've heard an awful lot about in the media of recent times is this idea of a post-antibiotic era. Most of us have grown up with antibiotics. When we were young, if you got a bacterial infection, you went to the doctor and you got treated with antibiotics. Infection went and that was fine. But we're now approaching what's called the perfect storm. And the perfect storm is effectively because of this idea of resistance. We've been throwing antibiotics at bacteria for too long now. In many cases, some would argue inappropriately, and the bacteria are finding mechanisms to resist that. The reason it's a perfect storm is because allied with that is the fact that there's been a massive drop-off to almost non-existence in the discovery of new drugs. So on the one hand, the bacteria are becoming resistant and are no longer treatable by the antibiotics that we have. And on the other hand, we're not finding any new antibiotics. So for that, we've got to think differently. And I suppose that's where we fit in Biomerit. We take a different approach. It's not simply looking for antibiotics that kill bacteria, because if you do that, they'll find a way around it. We look and say, okay, if we can treat an acute infection, okay, but not a chronic, what causes the bacteria to switch to that chronic state? If you can understand that, you can lock it in an acute state and then maybe treat it with the antibiotic. Okay, so one of the ways, or one of the, I suppose, most exciting areas of research that we've had in the recent years was looking at what causes bacteria to turn chronic in cystic fibrosis patients. And we were looking at medical journals in recent years, and there was this large prevalence of a condition called gastroesophageal reflux. We all get reflux. If you have spicy food, sometimes if you drink cider, you get reflux. And effectively, it's the contents of your stomach entering into your esophagus. Okay, but in patients with cystic fibrosis, they have an added complication which is called aspiration. And because they get such severe reflux, the contents of their stomach actually end up in their lungs. So what we did is we took that and we said, okay, what happens when the bacteria in the lungs see the contents of the stomach? And we picked some of the primary contents, one being bile. And what we found was that when the bacteria in the lungs saw bile, they switched immediately in a test tube to a chronic phenotype. So everything that they did in response to bile was to turn chronic. So the next thing was to prove that bile was present in the lungs. So we took samples from the sputum of cystic fibrosis patients. It's a pediatric clinic up in CUH. We're working there with Drs. Myrni Chronin and Dave Milan. And we took the sputum from the pediatric CF patients and we looked to see if they had bile in the lungs or not. Those that did have bile in their lungs had the microbiology of a CF patient. Those that didn't have bile in their lungs had the microbiology of a healthy patient, even though they were CF, even though they had cystic fibrosis. So certainly it's an exciting part of the research. It's something that's taking a lot of hold globally, but it certainly looks very strong as if this could be a major trigger causing bacteria to adopt this chronic lifestyle.